So, Harrison,
Yes.
you are heading up this facility. Since the start.
Yes, it's the start. It's almost 8 years now. It's the 9th year
Yeah.
we have been operating the facility,
Yeah,
and I was here since the beginning.
fantastic. If I would ask you then, what do you see? What are the biggest challenges as you can see them now? The two biggest challenges into the future.
Okay, into the future of this is that we are helping the community as of now.
Yes.
Now, the community, what you should understand is that they are more or less poor, per se. You can just say per se. The facility has very good standards in terms of care and the type of services we're giving. But to get those the standards is very expensive, and the community is poor, and we have to give the services as the required services. So that's a very big challenge. And in that I mean I have a very big budget which cannot be met by the poor population. And in my what I'm striving to is sustainability. So with the poverty and the bigger budget, we have to go through sustainability. That's a very big challenge.
But so what can be done? What is needed? I mean, like more practical.
More practical, what we have put in place, we have currently in the facility in my development. I have decided we have managed to go through national insurance funds and trying to get some other services paid by the insurance. Now we are also selling other services to other hospitals who do not have such. In a good example is the X-rays, which other facilities don't have. So we are selling that service to them. We have also established some relations with companies, and they have bought some services for us, and we are selling them at a higher price than the normal price.
So that's financial.
That's
stability.
financial stability.
Yes.
Then we are looking at getting to have some base of finance in terms of maybe fundraisings
Yes.
to make sure we have enough capital for the future. We last 2 years ago I went to Sweden, to Stockholm, and we managed to make a fundraising for the future of Kinondo through the Kinondo support. Now with that, it will help us to focus more on the future in terms of financial stability.
So what you can do, I'm thinking, of course, of visitors. So you can actually sponsor like an HIV testing kit. You can sponsor a young mother.
Yeah.
You can sponsor also the ambulance.
Yes.
You have a number of sponsor possibilities here.
The major focus we are doing right now is that, as I've mentioned about the National Hospital Insurance Fund, is that we have antenatal mothers whom we are sure that at the end of maybe 9 months they will deliver. Now, once we insure these mothers, the national scheme accepts insurance for 6,000 Kenya shillings for the whole year. Within that, once the delivery is done, they pay us 10,000 shillings, so it's money back. So we really want to focus on if there's a way some donors can donate for like a family to support in insurance cover for a family or the pregnant women. At least they get a good cover in the pregnancy care period. So that is where we're focusing on, and it's good to donate for a package of health directly to maybe one family. So a family is supported by like 6,000 Kenya shillings. That's one family for the whole year.
Ungefär 450 kronor.
An average family in Kenya is like six people. So for 6,000, you're supporting 6 people for a whole year.
Yeah.
Yeah.
So how about education for staff? and things. How do you do that, or?
For education for staff, okay, my local arrangement is that we have continuous medical education every Wednesday, but we're focusing on internet learning, e-learning services with other consultancy in Europe.
Okay.
We are looking forward to get these guys known as Doc Connect to help us in not only education by consultancy online.
That's great.
Yeah.
We have established, we have started the internet network online place,
Yeah.
so that we can do this exchange very well. And that is our main focus on the X-rays done, so that when we do an X-ray, we can put it on the
Yeah.
web.
Yeah, you
be
can
shared,
send it.
yeah.
Yeah.
Someone can read.
Yeah.
We don't have specialist
Yeah.
doctors to
Exactly.
read X-rays here.
That's very good.
So, and reading an X-ray, the only doctor, all these 600,000 people living in Kwale County, there's no radiologist.
Oh yeah.
Imagine.
There's no radio. We only have one radiologist in person. It's a private radiologist.
Yes.
So, if we send a physical
Yeah.
X-ray, it costs maybe transport, and also reading is 300 shillings.
Yeah.
If that can be online, it could save a lot of time and money.
And also more adequate, maybe.
Readings. Yeah.
Readings.
Yeah, more adequate and very accurate
Exactly.
reading.
Exactly.
Yeah. So that is